Hello, everyone, and welcome to the weekly webinar series with AIHM. We're very excited this week to have a special guest here, Dr. Irina Todorov from the Cleveland Clinic Center for Integrative and Lifestyle Medicine. So I'm just going to take a few minutes to talk about the Academy of Integrative Health and Medicine as all of you are coming into the webinar. So welcome. We're very excited to be here today. Next slide.
Do you see the slides, Tabby?
I don't.
Okay, click on your Zoom and two-finger click on your Zoom icon.
There we go. Thank you.
Welcome.
So just for those of you who are joining us for the first time, the Academy of Integrative Health and Medicine is an interprofessional integrative health association working to transform healthcare, body, mind, spirit, community, and planet. And we started back in 1978. We brought together multiple organizations, including the American Holistic Medical Association, AIHM, and most recently, the Academic Collaborative for Integrative Health. And you all can find us at YouTube at AIHM Global. And all of our webinars are uploaded to the YouTube channel afterwards. So if you want to come back, if you want to share this with colleagues, share it with students, other clinicians, please, we welcome that. For those of you who are interested in studying more formally integrative health and medicine, we do offer a fellowship program. It is a 2-year, 1,000-hour program that does allow MDs and DOs to sit for the ABOIM board exam in the United States. This is an interprofessional fellowship. It really is an amazing educational experience. So if you're interested, we have a new cohort starting in October. If you'd like to join cohort 13, you can mention this webinar and get a discount on your tuition if you get accepted. So I'd love to welcome and tell a little bit about our Integrative Practice Webinars project. This has been a long-standing multi-year project started by the Academic Collaborative for Integrative Health that is really about increasing on the understanding about integrative practices out there and different models. So I'd like to welcome Dr. Steven Cena, who is a licensed acupuncturist. He is an assistant professor specializing in integrating East Asian and allopathic medical approaches for the treatment of orthopedic conditions and pain disorders. Since 2001, he's treated numerous patients from professional athletes to those with chronic and debilitating pain conditions. Dr. Cena serves as a full-time faculty member of the New England School of Acupuncture at MCPHS University, where he teaches courses in structural anatomy, orthopedic acupuncture, and doctoral level integrative pain management. He's a member of the MCPHS Center for Interprofessional Practice and Education and its pain management subgroup. He's also the Student Association of the New England School of Acupuncture faculty advisor. And his accomplishments include acupuncture research at Massachusetts General Hospital's Athenula Martino Center for Biomedical Imaging. He's a contributing member of the Academic Consortium for Integrative Health, the chair of the Student Leadership Committee for the American Society of Acupuncturists, and team acupuncturist for both the Boston Bruins and the New England Patriots. So Dr. Cena, it's wonderful to have you here to talk a little bit about the series and introduce our guest speaker.
Thank you, Tabby, for that introduction. As Tabby mentioned, my name is Steve Cena. I've worked with the Collaborative for many years now, most recently as part of the Integrative Practice Webinar series, and I'm delighted to welcome everyone to this presentation. This webinar series spotlights integrative clinics that demonstrate innovation, leadership, and service in the field of integrative care And today's presentation is on Cleveland Clinic Center for Integrative and Lifestyle Medicines, modeling integrative medicine within a large hospital system. Highlights this amazing work being done there, and I'm excited to introduce Dr. Irina Todorov, who is the medical director of this center. Dr. Todorov is board certified in Family and Integrative Medicine and believes that we should all strive to achieve optimal physical, social, and mental health. Dr. Todorov uses treatment modalities like nutrition optimization, exercise therapy, herbs, acupuncture, mind, body, and manual therapies to enhance the body's healing process. I'd like to welcome Dr. Todorov to this presentation.
Thank you for the invitation and the opportunity. Let me share my screen. Okay, you see my screen now?
Yes.
Yes, thank you. So again, thank you for the opportunity to share the Cleveland Clinic model of incorporating integrative medicine within a large hospital system. And again, Cleveland Clinic has more than 72,000 employees. We have clinics in Ohio, in Florida, in Las Vegas, and as of this year, we have a clinic in London, also in Abu Dhabi. So again, it's a truly representative of a large hospital system and academic center. So today my goal is to walk you through what are the different service lines that we have, what is the different team members, and how we offer different treatment modality primarily in two different ways: individual visit and shared medical appointments. When you're part of a large system, you have to align your clinic's mission with the mission of the bigger, the larger hospital system. So Cleveland Clinic mission is in three different areas, and that's typical for most academic centers. First one is clinical care. And here, our goal is to provide the best clinical care that is possible for the patient, and also to create an environment which is the best place to work in healthcare. The second is working on research, and the third one is education. And I will again walk through these three areas, how we are contributing in each of this area. I will start with the timeline. So where we are coming from, how we started, and where we are now. So our clinic started in 2004 by vision and by one person, Dr. Tanya Edwards. And she's again the visionary behind the clinic, and now the clinic carries her name. And it started with one physician and one acupuncturist. And again, that's 2004, and Cleveland Clinic last year celebrated 100-year anniversary. So there was a physician and acupuncturist until 2010, when this third treatment line was added, and that's a holistic psychotherapy. A little bit later in 2012, chiropractic care was added, and then Chinese herbal medicine in 2014. In 2008, a different group started a lifestyle medicine in a program called Lifestyle 180. And in that program, there was a yoga instructor, culinary medicine like a chef, massage therapy, physician, and nutritionist. Later on, these two groups came together, and they were combined in the Center of Integrative and Lifestyle Medicine. And again, starting with, one physician, now we're providing around 40,000 visits per year. I also noted here 2011 when we started to do a shared acupuncture appointments, and 2012, the first shared medical appointment, since now this is an signature, like integral part of the way we provide care. So what is the current state? Currently, we have, as you can see, 9 physicians, 8 acupuncturists, 6 chiropractors, 8 mind-body therapists, nutritionists, yoga instructor, 1 full-time yoga instructor, and many per diem. We have chef and sous chef to lead the culinary medicine, and many massage therapists. When I mentioned 9 physicians, many of the physicians do not necessarily practice full-time integrative medicine. We have one physician that is part of the IT team, so that help also to integrate many things into the EPIC and advance in that area. We have another physician that is 80% research time. So the delivery method, we deliver method in 2 different models. One is individual visit, and the other one is shared medical appointment. And shared medical appointment, if you look at the research and other clinics, it's known also as a group medical visit, group visits, where you will see multiple patients with similar medical problems at the same time. In the individual visits, what are the benefits? So it's a one-to-one visit, it's personalized, you create individual plan for that specific patient, you include different modalities, and there might be sometimes a lot of coordination between that many individual visits. The benefits of the shared medical appointment is, I would think the biggest benefit is the group support, the social support, and being in a group with other patients with a similar medical problem and seeing the success when they make these lifestyle changes. I will start first with the individual visit. And I try to create a visual visualization of, like, once I, let's say, go on Monday at work and I have 4 different patients with the same problem, for example, chronic low back pain. And even if they come with the same chief complaint, they receive the individualized multimodal, multidisciplinary plan that is developed. So, for example, the first patient A, when after the examination, talking about their beliefs, what they have tried, what they have failed, what was successful in the past, also what is available in their area, what is covered by their insurance, might go home with a plan that include acupuncture, chair yoga, and weight management. Patient B with the similar problem presenting to the clinic may go home with prescription for physical therapy, topical creams, and massage therapy. Patient C might want to start first with nutritional changes, aquatics, and taking some supplements, and at this point not ready to do more physical exercise or to try any new treatment modalities like acupuncture and chiropractic care. And again, patient D might have noticed that they have more pain with stress, so they might want to start working there. So I will go through all different modalities, how it's set up in our clinic, and with the idea that if somebody wants to start a practice or add a different line that can be used as a template. So for us, the initial visit for a physician is 1 hour, and the follow-up visit is 30 minutes. It is offered in person, and since 2020, like everybody else, we started offering virtually, and it's a very successful and popular way of patients seeing us. The visits are covered by all major health insurances. Seeing an integrative medicine physician is the same as seeing any other physician in Cleveland Clinic. We bill based on time-based billing. We also make sure that all of our providers are board certified or board eligible for the American Board of Integrative Medicine or American Board of Lifestyle Medicine. And patient resources, at the beginning, when the clinic was started, most patients were coming through self-referral, and now most are coming through internal referral from providers within the Cleveland Clinic. We do see many patients out of state traveling for higher level of care to Cleveland Clinic. The second service line that I want to review is a chiropractic care. And again, first I want to look at, what is the statistics? 10% of the US adults use chiropractic care in 2017 based on the national survey. Chiropractors treat 35 million Americans annually. And when you look at the American College of Physicians guidelines, for example, for treating of back pain, that's one of the recommendations for first line of treatment. And at the same time, when you look at how many hospitals have chiropractors on staff or have multiple chiropractors to meet that demand, it's probably not many. We started in 2012 with one chiropractor. We have 3 until last year, and we just added 3 more chiropractors, and we provide care at 11 locations. Again, we started with one location, and now we're making like a mini clinic. So you have the core services in each location close to patient's home. Again, that's one way how you can reach more patients. All Cleveland Clinic chiropractors are certified by the Ohio State Chiropractic Board. What is the safety? Since the beginning of the chiropractic services in Cleveland Clinic, we do not have any major adverse effect. Insurance coverage. So Medicare, Medicaid is covering chiropractic care, worker compensation, many private health insurance, and actually it's more and more insurances are expanding the coverage and the conditions they are covered. Cleveland Clinic is a hospital itself, but also we have our own healthcare plan, and our healthcare plan for the employee covers 30 visits per year with $35 copay. A couple of years ago, there was a $10 copay, and again, that's something we need to lobby and negotiate and discuss with your employee plan. So how is the template of the chiropractor set up? Most of the chiropractors work at the 10-hour shifts 4 days a week, but we do have some that are 8-hour shifts 5 days a week. The reason for the 10-hour shift is because we go to different locations, and that require, let's say, travel 30 minutes, 1 hour to that location. Also, we are guests in this clinic, so we try to maximize the use of the rooms that we have there. And the third thing that we are accomplishing with the longer shift hours is we offer early morning and late evening availability for patients. Their template is set up for a new provider at 60 minutes for a new visit and 30 minutes for a follow-up visit. And when they're seasoned providers, they move to 30 minutes for a new patient and 15 minutes for a follow-up. They are supported by front desk. They do have MA support, and most of them have massage therapists working with them. So when you see that 30, 60 minutes and 50, 30, let's say we don't have a massage therapy at that moment. They are away for 2 weeks or they left and we're looking for a new one. Then right away we extend the time that the chiropractor have with the patient. Or if we're in a location where we don't have a MA support. The other benefit of chiropractic care being part of a hospital system versus sending the patient out to a chiropractic office is they have access to all medical records. They can see all the imaging. They can email. They can do e-consult with orthopedic surgeon, with any other specialist, neurology in the clinic. And again, we have now grown to 11 locations to provide care. The next service line that is growing fast is acupuncture. As I mentioned, we have 8 acupuncturists currently. Again, acupuncture is one of the recommended treatment for acute and chronic back pain. So the interesting part of this recommendation when it came in was like, okay, this is the first line of treatment, but these modalities are not available within the hospital systems. Also, we're seeing that more and more people know what acupuncture is, and they are using it. And the best that I could find was from 2007, 14 million users. I couldn't find the recent, but if you know of like how much is the users now, please put it on the chat. All Cleveland Clinic providers are licensed acupuncturists by the State Medical Board of Ohio. Again, safety, we don't have any major side effects. Most are related, we had a couple maybe with retained needles. So we have many safety protocols developed to make sure safety of the patients. Insurance coverage, Medicaid covered 30 visits per year, covered diagnosis, low back pain and migraine. Our own Cleveland Clinic Health Plan until 2021 was covering 10 visits per year with $35 copay. For 2022, they changed the coverage to 50% of the final bill, which is now around $106, but no limit of the visits. So we always check the coverage before patient is scheduled. Also, in our own plan, they cover chronic pain and chronic migraine for acupuncture treatment. Because some insurance still do not cover acupuncture or there is a high copay, we have created in 2011 the shared acupuncture medical appointment. We are lucky that we have a space that accommodates 12 patients, so we have 12 chairs. Patients are coming every 10 minutes, and they are referred to the shared acupuncture medical appointment after they have been seen in a one-to-one visit with acupuncturist, and so they already know the treatment plan. And this cost $40, so we are able to keep the cost down, so people can use that service even if it's not covered by their insurance. Their template, again, by choice, and to provide like early morning, late evening appointments, and to maximize use of the rooms on the satellite locations. We do have a 10-hour shifts 4 days a week or 8-hour shifts 5 days a week. For new patients, they have 60 minutes, and for return patients, they have 30 minutes. In the past, we have unlimited new patients, and the problem is that if you have too many new patients, you cannot have a follow-up. So the worst case scenarios, you see a patient and you say like, okay, I have to see you twice a week for 3 weeks or once a week for the next 5 weeks, and the first available appointment is in 5 or 6 weeks. So we start doing, when you do the first appointment, you also schedule the second and third appointment at the same time. They do have a front desk support, and our team choose not to have the MA support. So they are taking care of their own rooms, preparing, setup. So they have a setup time at the beginning and the end of the day, especially when they're in the satellite locations for that. They do have access for the, to the electronic medical record to review patients' records, to email, send messages to primary care physician or referring physician. We do provide care in 10 different locations. In 2012, Chinese herbal medicine became part of the Ohio practice law. So that was a big change, big news. And in 2014, we started to provide individual consult with a custom traditional Chinese medicine formulas. What does it mean? When the provider is prescribing a herbal blend, so they come in a granules that are put into a capsule and they are shipped directly to the patient's home. They come back in 3 weeks later, and the prescriber changes, the number, the blend of the herbals that they prescribe, and the new capsules are mailed to the patient's home. Since this was a new program, we were checking CMP, so complete metabolic panel, before we start the treatment on the first month, the third month, the 6 months, and yearly after that. This is not and still not covered by any insurance. The cost is $150, and it's 1 hour long appointment, and the follow-up is 30 minutes, $75. It is offered in person and virtually, and as I mentioned, not covered by the insurance. So the cool thing is they put the prescription with the herbal blend in the Epic, so any physician, anybody in Epic can see that, and it includes the Chinese name and the pharmacology name for that. And in 2018, also we started to carry patented traditional Chinese medicine formulas, and the acupuncturist can prescribe that during the acupuncture visit. Again, the traditional Chinese medicine individual appointments not being covered by insurance are precluding some people to get that type of service. And when we opened the clinic in 2014, it actually made news throughout the country. It was covered by Fox News, the Wall Street Journal, US News, Time Magazine, Today. So that was the first large hospital system that offered traditional Chinese medicine as a treatment modality. The next big group, and I would say a very important part, is holistic psychotherapy. Currently, we do have 8 holistic psychotherapy. All providers are licensed by the Ohio Licensing Board of Counselors, Social Workers, and Marriage and Family Therapists. They treat diagnoses like PTSD, depression, anxiety, chronic pain. They are a very integral part of our shared medical appointments. And again, treating stress, depression, anxiety, it's a very important part of treating chronic pain, and it's recommended in one of the initial treatment for treating chronic pain. How is the template set for holistic psychotherapy? Similar, they like the 10-hour shift, again, provides early and late hours for patients. They are currently at 50% virtual visit and 50% in-person visit. And maybe just to jump back, like a chiropractors have only in-person, acupuncture has only in-person visits. For physician, the template is set up as either. So my whole template is I can have like 2-hour virtual visit and 1 hour in-person, then 2-hour virtual, then 4 hours in-person. And that is based on patient's preference. While in holistic psych, they have a day of virtual, a day of in-person. Insurance coverage, again, they're covered by most health insurances, including Medicaid and Medicare. Cleveland Clinic Health Plan, our Cleveland Clinic insurance covers with the copay of $35 and no visit limits. They do not need an MA support, but they do have a front desk support. Massage therapy is another big group that we have as part of our team. And again, that's something that we always have to think of why this type of care is offered in an outpatient setting or out of the hospital setting. In a 2021 massage professional research report that was published, they asked people, where do you get your massage therapy? And as you can see, 60% was at the spa or massage therapy. And then there was different other locations, but truly in the doctor's office, in the hospital, it was around 5%, and then 5% in the chiropractic office. Again, 50 million American adults discuss massage therapy with their doctor or healthcare providers in the previous year. So I have a patient in front of me. I say, yes, massage is great for you. And if I don't have them as part of our clinic, then I would say, okay, just go and find somebody who, check, do they have a license, and get care there. And if it's part, and it should be part of the hospital system. All Cleveland Clinic providers are certified by the Ohio Medical Board. Massage that we offer is not covered by health insurances. Cost is $75 per 1 hour massage, and discounted price, we offer discounted price for Cleveland Clinic employee at $60. And patients can use their flexible spending account to pay for the massage therapy. And again, it depends on the different flexible spending accounts. We offer it in an outpatient setting only. And I have listened to amazing lectures coming from Mayo Clinic and research that they're doing about massage on an inpatient setting. So if you want to extend that to inpatient, you should look at how it's set up in Mayo Clinic. The appointments we have are 60 minutes appointments with 20 minutes break. So that makes it a full day for a massage therapist is 5 appointments a day. So this is, when I mentioned massage therapy, part of the massage therapy group is just massage therapists who does massage, 1-hour massages, and the other half are massage therapists that support a chiropractor. So they work together with the chiropractor. They don't have their own schedule. We do offer nutrition consults, and they're set up like any other consults. Most hospitals do have already nutritions, nothing different. We offer them in person or virtually. It's covered by most insurance. Currently, we have 45 minutes long visits. We do have yoga instructor. And in addition of the yoga, participating in many community classes offered as part of the shared medical appointment is actually offered as a one-to-one visit with the yoga instructor to create a specific program for you. And that is at $75 per 1-hour consult. Culinary medicine consults, it's now offered in person only. We try them virtually, and we recently increased the price to $200, and it's a 1-hour long visit. E-coaching is something that was part of our department, but still now in a different location in Cleveland Clinic, but we work very closely with them. They offer a program for smoking cessation, weight management, diabetes, pregnancy support, stress. So e-coaching, meaning the coaching happens through the email and not one-to-one in clinic. It is free for Cleveland Clinic patients, and again, I regularly use them for depression, for weight management, and diabetes. So all of this service line that I walked you through were individual visits. So what happened is the patient comes in, sees me, and okay, we create a great plan that you have to see a chiropractic care and acupuncture and maybe massage therapy or nutritionist or holistic psych. So the patient may end up going out and scheduling appointment with chiropractic care, and patient might need like 6-8 visits, and then acupuncture 10-12 visits, and seeing a nutritionist. So this might end up a lot of coordination, a lot of visits to the clinic, but at the same time, it's a personalized, and it's exactly what the patient is looking for. And it's a great way of delivering care for some patients. While with shared medical appointment, patient comes to the clinic for that 2-hour class or 1.5-hour class, and in the same class, they get acupuncture and guided meditation during the acupuncture, chair yoga, and different kind of education. But it is maybe at a time that they have to spend 2 hours during work hours. So again, different models work differently, but the social support, the group support is, I would say, is the most important difference. So what are the benefits for the patient in the shared medical appointments? Again, patient education, they can come 6-8 times, and we build up what we have taught or covered on the last visit. Also, some patients may have questions that they didn't think to ask or were uncomfortable to ask, but somebody else in the group are asking, and now they know the answer. Also, they have the opportunity to experience new modality. Sometimes I mentioned, like, let's do chair yoga, and the patient says, wow, yoga, it's a very difficult. I don't want to try. But once they do a chair yoga in class, they say, oh, actually, that's very manageable. I can do that every day. What is the benefit for the provider? So spending more time with the patient. So in a 2-hour visit with the patient, we can answer all their questions. I can build on what I have taught the previous time versus spending 10 minutes on nutrition. I can spend, 20 minutes and, the next time patients have questions and then build up on that one, like over 6 visits, and I can cover more in deep different topics. And again, remove that repetition and leverage resources. When we talk about shared medical appointment, there is a different models. In our model, I call it like a closed group model. When patients sign up for Monday evening class 5:30, it means that they are signed up for 6 classes at Monday 6:30, or if they sign up for Tuesday morning, it's always Tuesday morning. So that's kind of provide like easy to remember to come at the same time, but also because we do have 5 groups going simultaneously on our weight management program. If your patient cannot come for whatever reason, in that specific day or time, they can call earlier and say, okay, today I have another appointment, or I have to go out with friends on Monday. Can I take the Wednesday or Thursday class? And they will get exactly the same material, exactly the same experience. It doesn't matter if it's yoga or guided meditation. So the team, again, every class has a different team, and I'll walk you through. In a setting, again, we're very lucky to have 3 large shared medical appointments and also yoga room, but all can be done in a room that you're seeing on the screen where you can put patients. Once COVID started, of course, we transitioned everything to virtual visit. Now we're back, and some of them we offer both virtual and in person. And the benefit on the virtual visit is now we can have patients from Cincinnati joining in our weight management class, because they don't have to drive to be there, versus when it was in person, to be at 5:30, done with work and being in the class, you kind of limit that service to people who are living like 20-30 miles around the clinic. And these are the most popular shared medical appointments that we have at the moment, and I'll walk you through all of them. So the Eating Well for Optimal Health, this is a program that addresses unhealthy eating habits, help patients with emotional eating, stress eating. We talk about Mediterranean diet, but also we talk sleep, stress, intermittent fasting, ultra-processed food, and so on. This class is 1.5 hours long. It's 6 classes consecutive once a week for 6 weeks. And we have currently 5 cohorts a week. And we had in person 12 people in before COVID. Then we went to 12-person virtual. Then we reopened with 6 patients. So now we're back to 10 patients per group. And we do have the team here. It's every time from the beginning to the end. We have a physician and holistic psychotherapy, and the holistic psychotherapy is a facilitator for this group. And again, we have the yoga instructor just log in for the last 10 minutes of the class. Culinary medicine for chronic disease. Again, we do have a chef, we have a teaching kitchen, and that allows us to provide that service to patients. This consists of 6 consecutive visits. This happens every week, and it's 2 hours long because of the time in the kitchen. It's 8 to 10 patients, and it's offered in person. We tried for a little bit to do it virtually, but we believe that the smell, the taste, the touching, the cooking in the class, it's much more beneficial when it's done in person. And we cover topics like Mediterranean diet, unhealthy food choices, and so on. Long COVID shared medical appointment, it's something that we started in 2021. Once Cleveland Clinic started Recover Clinic, and which was specifically designed for patients with long COVID. And the biggest benefit of this class or shared medical appointment is actually putting people in the same class. Many times people cry on the first visit, saying that they have never met anybody who has long COVID symptoms, or people are not believing them, that things have changed now. And we cover their diet, emotional stress, sleep, physical activity, and again, in every sessions we do mindfulness practice. Here again, the facilitator is the holistic psychotherapist and physician. So these are the two team players in the group. We have a brain health and wellness. Here we do 6 visits. This one is every other week, 7 to 10 patients per group. We do have both in person and virtually offering classes. Here we actually tried the yoga therapist to be our facilitator, and it's working very well. So it's just, again, depends on who is on your team, what skill set they have. You can use a facilitator, holistic psychotherapy, if you have an RN, even if you have an MA, that you can, walk them through classes. As a facilitator, like, if they can learn that kind of skills. And last but not least is the living well with chronic pain shared medical appointment. This one is a little bit more people intensive or involved. It's 8 weeks long classes. It's 2 hours long, and every class people get a guided meditation while they're having auricular acupuncture. That's for around 35-40 minutes. They have 15 minutes yoga, and we have an education at the beginning of the class. And every time they have a lecture on a different topic. So one week is a chiropractor talking about the posture or how to hold the phone. The next time is the massage therapy, talking about self-massage and actually trying massage on everybody for 5 minutes. We go to the kitchen one. We talk about stress management. Again, these are all the topics that we cover. Nutrition, importance of sleep, social belonging, living with purpose, spending time in nature, also vitamin deficiencies, and practicing mindfulness. These are pictures from our shared medical appointment. As you can see, you can do all activities in the same room. So if you have one room, you can do auricular acupuncture there and chair yoga there. We do have luxury to go in a different room for the acupuncture and yoga during class. So with this, I want to switch gear back to the mission statement. So I just covered the clinical care, taking care of patients. And now I will move to our research activity, and then we'll move to the educational activity. So the living well with chronic pain shared medical appointment that I just reviewed, we said, okay, we're seeing a great improvement, but how we can share that this is actually working. And we were able to gather data from the first and last visit with Promise 57. We gathered the BMI, body mass index, and pain intensity in a scale from 1 to 10. And we got 189 data sets that were full data sets. So we have all questions answered, everything, BMI, pain intensity at the beginning and at the end. And the result shows that more than 50% did show improvement in all 9 domains. As you can see here, we had patients between 26 and 90 with average age 61, but primarily they were women and primarily white. So the results was published last year in Pain Medicine in February 2021. Again, result shows that there is statistically significant improvement in all domains, like physical functioning, anxiety, depression, fatigue, social roles, pain interference, and sleep disturbance. And we also try to look at if patients decrease the opioid use as a result of taking the class, and it did show non-significant improvement at week 8, but when you follow the same patient at 6 and 12 months, did not show any change. Living Well with Chronic Pain again concluded that if you are creating that multidisciplinary non-pharmacological treatment approach delivered via shared medical appointment, lead to reduced pain, improve measure of physical, mental, and social well-being without increase the use of opioid pain medications. So another research that we were involved this year was we tried to do inpatient acupuncture pilot study before and after coronary artery bypass. And the goal was to get 30 patients enrolled. And our early findings were reported at the consortium meeting this spring, and it shows and suggests that acupuncture may be acceptable and helpful for reducing preoperative anxiety and post-operative pain in patients undergoing coronary artery bypass surgery. Our long COVID shared medical appointment, same thing. We were able to track 8 cohorts, 8 classes, and they saw that there is more than 80% of the participants attended at least 4 of the 6 sessions. And the conclusion was that the shared medical appointment with the lifestyle education around nutrition, mindfulness practices, and peer support can effectively support patients with the long COVID symptoms. Currently, there is many other projects, and some of them are with yoga and chronic low back pain. Also, it's a very interesting study. We're involved in creating a healthy lifestyle intervention for patients with epilepsy. We're tracking also outcomes for other shared medical appointments like brain health and lifestyle essentials. We're looking at the Cleveland Clinic Wellness Program effect on aging among our own Cleveland Clinic employee. Also now we're adding the home blood pressure monitoring in our Eating Well class. So patients are given blood pressure monitors. And so that's done simultaneously at the same time when we're doing the weight management class. Again, these are all that are going right now. And the third very important mission in any academic center and any large hospital system, including Cleveland Clinic, is education. So for education, we provide education for medical students and residents. We offer 2 weeks rotations, and preference, we always give preference to students that come from Lerner College of Medicine and Case Western Reserve University. And we do have a wellness grant round, which is monthly. We offer CME for that, but unfortunately, it is accessible at the moment only for Cleveland Clinic employees. If anybody is interested for rotations, they can contact Michaela Judy, who is our educational coordinator. Also, as of last year, we started to offer a chiropractic internship. We had the first cohort last year of 2 interns at the same time. We just had a new one started, and that was as a result of collaboration with Parker University, Texas. So the current chiropractic interns come from that university. Again, if anybody is interested, can contact us. It takes some time to set up paperwork between the different universities. Acupuncture, we have acupuncture students also rotating with our acupuncture group. And the Lerner College of Medicine, in our case, Western Reserve University, they actually expressed interest with us to create elective acupuncture rotation for medical students, which is great because the students from the medical school, they are already exposed to acupuncture in the hospital setting. We also mentor medical students in a research project. Just this year, we had a student that had 3 different research that was published and got award for that. And last, it is community outreach, community service. So we have created many free resources that are available for Cleveland Clinic patients and actually for anybody who goes on our website. For example, we have Mindful Moments app, which has very good guided meditation that I pretty much recommend to every patient, and they are available for anybody. Another app that's available and free, it's Sleep app. There is also paid offerings for outside Cleveland Clinic clients like Stress Free Now, and these programs, many employers get that program for their employee. Go to Sleep online program, which is a 6-week course, and it's for cost $40. Workplace wellness. Again, there is many big company that come to Cleveland Clinic and ask to build an environment of health in your company. E-coaching, same thing. As I mentioned, it's free for our Cleveland Clinic patients, but it can be customized programs tailored by our health coach for $190 for 3 months. And here is our general email CILM. So that's the Center of Integrative and Lifestyle Medicine, and ccf.org, where you can ask for more information on any of these programs. Again, we present in our hospital, in the community, fairs with chiropractic screening, yoga sessions, culinary medicine, nutrition presentation. So now there is a primary care conference coming up next month, and we have 3 chiropractors that will set up shop. And so that's a nice opportunity to introduce that we do have a chiropractors, to collaborate with primary care physician, but at the same time to experience some of the treatments. We do many culinary medicine, cooking classes, demonstrations, and again, health screening in uninsured and underinsured. So these are some resources where you can share with your patient. They're again all free. When COVID started, and we kind of closed the clinic at the beginning, our chef Jim Perko and Dr. Mike Roizen started videotaping one cooking demonstration a week, and now they have more than 100. So they're still taping every week one new cooking video. Again, this is free and available for anyone to watch. Also, we have many recipes on our website. You know, our chef made a whole knife skills video of around 45 minutes of how to make sure you use properly knife, not to cut yourself, and how to cut, for example, you know, pumpkin, and so on. We do offer daily wellness tools for you program. So what this is we have meditation, we have Tai Chi, for example, Monday, 7:15, and that's Cleveland time. Anybody can take the classes for free, just need to go to the clevelandclinic.org, CILM events, and sign up, and you'll get the Zoom link like today, and you log in at the time and you follow the teacher, and you know, you can, that can be in your program, that can be in your calendar, and it can serve as a reminder. We also have many classes that are already taped, like a chair yoga for 1 hour, that you can watch at any time you want, or you can give a link to your patients. We also have a free wellness presentation virtual series that are held in January and April. So if you sign up, you'll get a reminder once we start in January. But the previous 2 years talks are available for viewing, so they're taped and on our website. Dr. Esselstyn is part of our clinic too. He offers a program about cardiovascular disease and learn how to slow it or reverse it through plant-based whole food diet. He offers the program, his Dr. Esselstyn program, once a month, which is now virtual, and it's 5 hours. And the next classes are starting in, as you can see, October 7, November 11, or December. If somebody is interested, here is the link to sign up for that program. And again, this is a self-paid, not covered by any insurance. And I'm amazed when I go to this program, we have people from Australia, from Europe, from different continents. So it's a very, very international group that attends it. So this is my actually last slide before we go to the questions and answers. And I just wanted to kind of go over what are the challenges, what are the opportunities. Again, we saw where we are coming, and the question now is where we are going, what's important. So I think one thing that we need to work on is acceptance of integrative medicine and educating others what is integrative medicine. Every time I have a patient, my first question is, do you know what integrative medicine is? How did your doctor describe it? Do you know what to expect from today's visit? And, you know, often frankly, patient says, I don't know. And I say, like, thank you for coming anyway. So let me give you like a small explanation of what we do, what modalities we have. So again, education to patient, but also education to other providers. So for example, if you're working in a system when there is, you know, I go to a different clinics and they have provider meeting once a month. So I go and say, can I talk to the providers, you know, for 5-10 minutes, give an overview that we're here, what we're doing. Also give a lecture to a resident, give a lecture to a community. If a primary care physician is interested to follow us or observe us, we create a special program, or they just want to observe our shared medical appointment. Again, we're talking about physicians within Cleveland Clinic. We offer that for them. Collaboration. So collaboration, think of, you want to create a shared medical appointment for headache, for example. So to do that, you need to work with somebody from neurology, somebody who is seeing a lot of headache patients. If you go to a leadership training and you meet other people, again, learn what their needs are, what are their challenging patients, and see how you can help with that. And again, the most important thing is to create evidence-based research. Every time you present, you need to show a data. You need to make sure you are offering treatment options that are evidence-based. And to do that, we need to do more research. And as you know, like, there is not a lot of funding for research. So anything helps, but truly to advance, you know, payment by insurance company, acceptance, then we need to do more research. So again, example, if you have a patient and you say, like, okay, manual therapies are helpful for your back pain or neck pain, and you can do aquatics, you can do physical therapy, you can do osteopathic manipulation, chiropractic care, massage therapy. Patient might choose based on what is actually covered, what is available in their area. Again, it might be covered, but if the closest one is an hour away, you know, that's really not accessible. So then the second one is accessibility. Again, offering that as a part of the hospital program sometimes make people more comfortable getting these services and trying these services. Again, is it covered? What is the cost of the program? And as I mentioned, availability and also convenience. I have many patients that come from rural areas, and like our virtual program, actually, it's a great fit for them, since they say, I don't have any chiropractor around me, I don't have massage therapy around me, or even yoga, but then you kind of like, okay, so we have a virtual classes, we have a virtual yoga, and they're free. So again, provide with what the patient is needed. So the next one is scalability. So when you create a program, think of how can you scale it up, how can you scale it to other people, and not just the people who live around. So again, example I'll give you 2 examples. Our Eating Well for Optimal Health involved physician holistic psychotherapy. Once we made it virtual, that expanded amazingly reach to people who previously were not coming. So even if we offer it in 3 or 4 locations, every location was getting only the patient that live 20, 30 miles around the clinic. And now that is much bigger. But think about pain management class, our class, it requires to have acupuncturist at the same time as holistic psychotherapy for the last 35 minutes. I need a yoga instructor and I need a physician. So we start taping a different lectures to see if we can offer it in a satellite location. So it's a very heavy duty, meaning high involvement of different providers. So the next step is, how can I make this a program that can be offered in many different locations? How can I change it or arrange it so this can happen? And the last one is through integration. Going back to the example of patient that came with a low back pain, and integrative medicine physicians see them, and you remember how I say okay, I can send you for chiropractor, I can send you for acupuncture, but these are all modalities that I chose because I have them as part of our clinic. And again, I also send them to aquatics, to physical therapy, the things that I have within a Cleveland clinic. But if they need, let's say injection or ketamine, they're going to a different place within Cleveland Clinic. Now we are working to develop a non-pharmacological chronic pain management clinic, which is truly integrated, where you have the anesthesiologist, the neurologist, the orthopedic surgeon, the integrative medicine physician in the same location. So you can truly offer all options at the same time, at the same location, and create a couple of locations so you can serve different areas within the Cleveland area. Again, now it's time for questions and answers. And here is my email if you have any questions. And this is our Cleveland Clinic Integrative Medicine email, which comes to our admin staff. And this is probably the best way to reach us.
Thank you, Dr. Todorov. It's an amazing presentation. It's very exciting to hear how much you're doing there. And I just hope other institutions try to emulate your model, even though I think it would be a quite difficult task to try to do that with all the offerings that you have. We do have many, many questions, and we'll try to get to what we can in the next few minutes. One question was, how do you bill for your medical shared visits?
Okay. So that's a great question. So for the shared medical appointments, all of them are led by a physician. So physician writes a note. Most of the 50% of the time has to be done by a physician, the education, the physical exam. So you bill as if you're seeing the patient one-to-one, so usually level 3. And I do a exam, pretty much check the lungs, the gait, the swelling of the legs. So you spend a little time with every patient, and I do have I give a small questionnaire, like what is the pain level today, what is the location, that helps me with the note. So you bill as if you're seeing patient individually, you put individual diagnosis, and you cannot make the same plan for everybody and put it for everybody, correct? Yeah.
Great, thank you. One more question. Some were asking, how does the Functional Medicine Center collaborate with your Integrative Medicine Center?
Again, great question, and coming at a great time. So we do have, and I didn't include that in the presentation, we do have a Center for Functional Medicine, and as of very recent, just went through the board. They are part of our department as of the last couple of weeks. So we will be in the same department of, so we're Department of Wellness and Preventative Medicine with two different centers. One is the Center of Functional Medicine and Center for Integrative and Lifestyle Medicine. So we're starting to integrate very closely. We put our chiropractor and acupuncturist already in their clinic, and our first collaborative pain clinic, I'm working on that pilot, will be at their site. Again, we're working to incorporate both clinics together.
Great. And if I can squeeze in one more question, how often do the healthcare practitioners come together? Is it through the electronic medical record as a collaboration, or do they actually meet and discuss patient cases?
Great question too. We do, let's talk 2 years ago, we were meeting once a month during lunch break. And so during that time, you can discuss the admin stuff. So last year we started meeting each other once a week. We blocked that time. And we had like a journal club once a week, different cases, and one more like admin stuff and education. Recently we're working on budgetary issues, so all of this is like on hold. So I would say between once a week and once a month.
Fantastic. Thank you so much for your presentation today. I think that'll end our Q&A for the session, so we can get to all your questions. Tabitha, did you want to add anything?
Yeah, so first I just want to thank you, Dr. Todorov. That was just really amazing what you all are doing. Hopefully more institutions and systems will follow this model and really reach out. I just love how open you are to sharing resources. It's really fantastic. And we, like I said, we will post this to YouTube after. You can also get the information on Facebook and then reach out to Dr. Todorov in the clinic. She provided contact information in the presentation. So just to close out, I'd like to just thank you all for coming. And this was such a well-received presentation, both here in the Zoom. We had lots of participants, lots of activity, and also online. Thank everyone for showing up in that space too. So I just wanted to close out. Caitlin, if you can share the slides again. Okay, there we go.
There, you got on your page.
Yes, I wanted to invite you all to our annual conference, the AIHM 2020 People, Planet, Purpose Conference. This year is on disruptive innovation and the future of health. It's coming up here in October, the 28th to the 30th, with a pre-conferences on the 27th and an organizational leadership summit as well. So we are almost sold out. So if you're interested in coming, please register now. It's going to be a phenomenal event. We are going to be in person in San Diego at Paradise Point, and we'll also, there is a hybrid option. So if you're not able to come to California, please sign up. And tonight at midnight, the early bird rates end. So this is the best time to get in at a great price. And I just really welcome you to join our global integrative community. We are a global organization. We're bringing together the integrative health community in many ways through administrators, clinicians, academics, researchers, to really just grow this movement and the resources available to patients everywhere. Together, we can definitely make a huge change if we work together to make that happen. And you can see that Dr. Todorov and their system at Cleveland Clinic is surely doing that. So if you want to connect with us, there's lots of ways to do that. You can find us on all the social media channels under AIHM Global. And again, please consider joining and becoming a member of our community. So thank you again. Thanks to the Integrative Practice Series group and all your leadership, Dr. Cena. And again, thanks to our guest speaker, Dr. Todorov, and all the work that's happening at Cleveland Clinic. We will see you all soon. Have a wonderful weekend.
Yeah. Thank you, guys.